Sir, myself Choudhary Subashbhai. I am from group number 3009. I explained the topic about malaria in India. Let's we start. It's here brief content about malaria. First of all, we discuss about the history of malaria. Then we go to the current situation. Then statistics. Then legislation, laws and orders. Then policies and programs. Then preventive measurements. Then conclusion, and finally the references. Here the history of malaria starts. The malaria is the fatal disease caused by parasite Plasmodium vivax and Plasmodium falciparum. In India, we all know that in India the malaria is very dangerous disease. In 1990s, in India, malaria is a major public health program in states having predominantly tribal population. The first case of malaria in India, 20 August 1897 in Secunderabad. In India, malaria most occurred in 1950s, 75 million cases in India and 0.8 million deaths per year in India. Malaria is originated in Africa. The risk is highest in northeastern state of Meghalaya, Mizoram. The state of Meghalaya and Mizoram are the rainy states. And the district of Amini in Arunachal Pradesh, the north and south Chhattisgarh, Orissa, and the city of Mangalore. In India, 1998 by WHO World Health Organization was, according to their report, 15 million malaria cases with 19,500 to 20,000 deaths per annum. According to the National Vector Borne Disease Control Program, it is the control program by Government of India at the time of malaria. We'll later discuss about this. According to this program, the reported 1.6 million cases in 2012, in them 50.01% are due to the Plasmodium falciparum. The 25th April is considered as the World Malaria Day. Here we are going to discuss about the current situation and trends about malaria in India. According to the World Malaria Report of 2017, in the year 2016, more than half of the population was risked at malaria of the world. According to this report, India accounted of 6% of the all malaria cases in the world and 6% of the deaths in the all over world, and the 51% of the global is by Plasmodium vivax cases. The report estimates the total cases in India at 1.31 million and the deaths at 20,990. In India, 2017 was placed 46th with a malaria deaths rate of 1.97 per 100,000 individuals. India reported 3 million fever cases in 2017 compared with 2016. 24% decreases being a unique case reporting progress in reducing its malaria cases in the period. As compared to 2017, in India reported 2.6 million fever cases in 2018, which shows that according to the 2017, the India decreases the almost 90% of decreases. As compared to 2017, India reported 2.6 million fewer cases in 2018, which shows that according to 2017, 90% of decreasing of being a unique case reporting progress. Here the map of showing the risk high towns for malaria in India. The main cities for malaria is Delhi, Faridabad, Ahmedabad, Morbi, Godhra, Rajkot, Gandhinagar, Vadodara, Mangalore, Mumbai, Dhule, Pune, Ratam, Shivpuri. They all are industrial belt, Argo base belt in Gujarat, Maharashtra, Madhya Pradesh, Haryana and Delhi. Statistics. Here the malaria card report of India. In 2018, the country will report an estimate 5.1 million cases. This remarkable decline over past 3 years can be attributed to the test threat track strategy. Number of malaria cases into this map shows that in 2013 to 2017, number of malaria cases and deaths. In 2013, 11.2 million cases. Death is 17,086. 2014, 11.4 million. Death is 20,647. In 2015, 12.2 million. Death is 22,326. In 2017, 12.6 million. Death is 22,786. In the 2017, the cases of malaria is 9.6 million and death is 16,737. 5 nations account for the nearly half of all malaria cases globally. Mortality of malaria. Here the rate of positivity at the age group. The rate of positivity less than 5-year-old in the 72%, greater than 5-year-old 67%, and the overall is 69%. Here the source that red one is in 2017, blue one is 2014, and the green one is 2015. Here it is the malaria parameter in India from 2001 to 2018 till July. Financials for malaria in India. The total income burden from malaria in India could be around US dollar of 1,940 million. The two main sources of financing National Vector-Borne Disease Control Program expenditure are the DBS and the EAC, where DBS is the domestic budgetary support and the EAC is the externally aided component. While the DBS has represent the central government contribution. Here we are discussing about the legislation, laws and orders of malaria in India. The first legislation laws of malaria in India is the Epidemic Disease Act in 1897 is a law which was first enacted to tackle this plague in Mumbai in former British India. The law is meant for containment of epidemics by providing special powers that are required for the implementation of containment measures to control the spread of disease. Here the second one is the act has been routinely used to certain various diseases in India such as swine flu, cholera, malaria and dengue. In 2018, the act was enforced as cholera began to spread in the region of Gujarat. In 2015, it was used to deal with dengue and malaria. In Chandigarh, and in 2019 it was invoked in Pune to combat swine flu. We are discussing about programs and policies of malaria. The first policy of malaria is in April 1953. The government of India commanded the National Malaria Control Program. Here the main policy of the India given by India is National Vector-Borne Disease Control Program, which is invented in 1953. The National Malaria Addiction Program commanded and operating in 1958. In 1977, the India is the Plasmodium falciparum containing program launch helping reduce falciparum malaria. In 2009, under the government of India's new National Malaria Control Policy. Further, we are going to discuss about the preventive measures. The preventive measures is divided into 3 phases. The control, the first one is A, second one is B, and third one is C. A consists of controlling insect breeding. The B is individual prevention, and third one C is prevention in community. The preventive measures in the control insect breeding. The all breeding places should be filled and covered. Avoid the storage of water in tires, pots, coolers and tanks. Regular cleaning of these all tires, pots, coolers and tanks as such articles is important to prevent mosquito breeding. Use of larvaceous fish like gambusia or guppy in ornamental tanks, fountains and other places. Use of chemical pesticides like abate in potable water. Individual prevention consists of use and intact. Individual is we are on. Individual prevention is the use and intact mosquito net while sleeping. Use mosquito repellent creams, liquid coils and mats. Use indoor residual spray with insecticides and use aerosol space spray during the daytime. Use biocides. Get houses fitted with wire mesh. Use bed nets treated with insecticides. Cover your body properly. The third one is C, prevention in community. In community, we are going to marathon fogging during outbreaks. The places around the hand pump should be properly cleaned along with the drainage system. Sanitizing and mobilizing the community to erect anopheles breeding sites. And the last one is conclusion. The conclusion of malaria in India is in India from 1990 to 2018 there is a decrease the patient of malaria. In the means our health working teams did a good job in controlling this dangerous disease which caused millions of deaths in past decades. As our medical education has grown up to a level that some of the countries of the world are declared free from the malaria. Policy by the government which included free treatment to the individuals also help poor people to easily get the treatment of this disease which further decrease the spread of malaria. Funding will remain the most important policy concern for the control, prevention and treatment of malaria. This is references. Thank you, sir.